Hi, I'm Dr. Loretta Stamba here with my video blog. I'm coming to you from my car, so please excuse my crazy, messy car. If you have kids, you know that it's never clean, and so I just kind of stopped trying and hope that it doesn't smell too awful. Today's blog is going to be about a couple things, but mainly toddlers. One of my favorite topics because I've had many of them, and I continue. Right now I have one. My youngest is 2. And I continue to be challenged with her behavior and the way that I respond to it. And so my husband and I are pretty thoughtful about what we've done in the past, what works. You have to respect that the children that you have are each very individual as far as their personality and their responses to things and what works. So that's the first and foremost thing to think about, is to make sure your children, you know your children, and you are in tune with what frustrates them and what makes them happy and what makes them mad and what makes them sad and how they express all these things, because that will help you to parent them and to discipline them in a way that is successful and gets you to a better place as a parent and as your day-to-day happenings occur. The main thing I think about toddlers is, we always say terrible 2s, we always say, the terrible 3s, the terrible 2s, whatever, and then us pediatricians always say, no, they're terrific, they're not terrible. I think they're terrific in a lot of ways, and they can be challenging in a lot of ways. I think what's helped me is to say, well, this kiddo is acting out or having a temper tantrum or crying for a reason usually. So, once you can sort of key into that and question yourself and say, what's really going on right now with this kid? Is it that he's tantruming because he's trying to be bad, or he's trying to get control over the situation, or because he is, just trying to challenge you and see what he can do? Well, part of it is about boundaries, and part of it is about, a child sort of testing the limits, like we say. But a lot of it really is frustration on their part because they can't communicate, or because they can't complete something that they want to do, or because we as parents changed the plans and said one thing and did another, or confused them in some way. So for me, like, if my kiddo is tantruming because I took the phone away because it's dinner time, which happened last night, I thought to myself, well, I have rules about screens at dinner, and so I don't want her having the iPhone at dinner time like the other kids don't have it, so she shouldn't have it. It's family time. But then I think, well, she doesn't understand the difference between 5 minutes ago and right now when we're sitting down to eat. She just knows she does not have that iPhone in her hand watching her cartoon. So for her, it was too much of a quick switch. All of a sudden she had it. She was enjoying it. We sit down. She's got food in front of her. Boom, can't have it. And that's really confusing for a 2-year-old. She just knows she wants it. And she just knows that crying is her expression of her frustration. And crying may be able to get her what she wants, or get the attention that she wants from the adults around her. So that's hard, because when you think, well, what do you do about that? Do you give in to everything because she's frustrated and you kind of feel bad for her that she's figuring it out? Not really. I mean, you still have to have the boundaries. You still have to say, okay, it's not acceptable for you to flip out like that. But you have to understand where it's coming from, and you have to sort of stay as kind and firm as you can with her, or with any of the kids when this happens. It's a process, and it's really an art, because I figure it out with one kid and then it comes up again with another kid, and then I feel like reading the parenting books and having all this information sometimes is a curse, because I probably would have just naturally done in the moment what I think my kid needs, or what I think my family needs, or what I think needs to be done specific to me, instead of having all these thoughts about what we should do, and we should do time out, and we should do this, and can't have this, and we need to have rules and all of that. Rules can be really good for kids if you're consistent with them and they're not too rigid. If they're part of the plan and they're part of the, basically coming up with the rules of the house and involved in it in a fun way, that can help you with older kids too. But with little ones, you have to kind of remember, okay, well, we distract them. Usually they'll stop screaming, or we'll ignore them and they won't continue because they know they're not getting the attention they need. But it's hard because nobody wants to hear screaming when you're fatigued and you're working hard and you're busy and you have all these things on your to-do list. So, the main thing is distract them, calmly talk to them, maybe remove them from the situation. That's what we did. We removed her from the situation, then we went and talked to her about it, gave her a little breathing room, and she came back and she was okay. They understand more than they can say at the age of 2 and 3, so part of that's frustrating for them because they can't communicate it, but part of it is really the core of why they get so frustrated, if that makes sense. They understand a lot, so you can say a lot and you can explain a lot and you can be calm, and they of course understand, the universal language of laughing and facial expression and the calming tone or not so calming tone in your voice. They pick that up and they get that, but parenting toddlers is difficult. So just remember, where's your kid coming from? Are they exhausted? Are they hungry? Are they frustrated because they can't do something physically that they think they want to do? When your 4-year-old is complaining because crying because she can't tie her shoe, or 5-year-old, then, don't necessarily rescue her and help her, but talk her through it. Let her kind of have patience with herself and realize that she's frustrated and she's yelling because she can't, get that shoe tied quickly like she wants to. She's just developmentally going through normal behavior, and so it's not being bad, it's just coming from her inner struggles. And so I think if you look at parenting that way, a lot of times you can get far, and you can sort of tweak your approach with each kid. But toddlers are hard. Picky eating is hard. I just don't have the fight. Just offer. They don't want to eat, they don't eat, and they'll be okay. They'll eat tomorrow. You offer good foods, you offer colorful foods, you make it fun, you kind of put the ball in their court and let them sort of self-regulate themselves and do it on their own. It never works when you're forcing kids to eat, counting and sort of, physically forcing them to eat the broccoli or whatever it is. It never works. And so just give it time, be patient, keep offering fun things, make it exciting, and then just give up the struggle. Like, there's no reason that everybody needs to get stressed out because they're not eating a vegetable one night. And they might not eat it for a couple nights or a couple weeks, but eventually they'll come around and it won't be associated with stress and turmoil in the family and a big, huge control struggle. But anyway, that's a little bit of that for now. Next up, I'm going to talk about well visits and what you can expect at each of them, starting from newborn and going all the way up to 5, or even actually past that. We'll talk a little bit about adolescence, because I think it's important for kids to know what to expect and for parents to know what to expect before you go in for your pediatric visit. So let me know your thoughts, comment below, and let me know if you have any other topics you'd like to hear about regarding pediatrics and parenting. Thanks. Bye.